This presentation is part of the NDS Safer and Stronger project, which focuses on supporting disability services in response to COVID-19. We are joined by Natasha Williams from GenU, sharing her team's experience and learnings from a COVID outbreak.
So in relation to our workforce preparation, we were having safety conversations with every resident, every worker, every family, and in every house. So those conversations were the what if conversations. So what if someone from your own family has COVID? What if one of the residents is diagnosed with COVID? What if you have to isolate for 4 weeks? How will you come to work? Do you need somewhere to stay? And also with the residents in relation to what if all the workforce couldn't support you anymore, we may have to have someone supporting you who you don't know. And those conversations at the start were one of the best strategies we had, and we realised at the end were some of the best conversations we'd invested in. We had got together a group of COVID casuals, which we call COVID casuals. It's probably not a great name, but that's what we called them. And they were a group of students studying their Cert 3s and Cert 4s in disability. And at the time, we'd brought them into paid shifts during COVID-1 into our sites to help those people become familiar with residents and the houses. And since COVID-2's come in, some of those people have actually continued to study and become full-time workers. We'd minimised our mobility in Melbourne. We'd supplied all our sites with PPE, and we'd even set up a warehouse in Geelong through our AGE area, and that's still running strong. We'd done business continuity planning and lots of training, and we prepared and sent communications to people, but also had prepared some mock communications in relation to the outbreak when and if that was going to happen. We engaged private testing companies for workers, and we also prepared essential info in all houses for new workers that might have to come in who weren't that familiar with the site. The situations that resulted in us having lockdowns at GenU, we had a worker test positive. We had several occasions where sole providers had notified us that they had tested positive after they'd visited a resident in the last week. We'd had situations where sole providers had been working alongside GenU staff and had tested positive. We had a lockdown after a resident was showing signs of COVID, but was unable to be tested because he didn't want to be tested. He probably didn't have the cognitive ability, to be honest, to understand what that meant, but he certainly wasn't letting anybody put that swab in his throat. So what we did is we tested other people around him, but we still locked that house down for 14 days. And obviously we've had lockdowns when residents have been tested. The outbreak we had happened on a Friday afternoon, because everything in disability services happens on a Friday afternoon. And that was the advice to us was a worker had tested positive due to an event outside of work. So all the staff were considered close contact, and there was a total of 8 staff that were sent home that afternoon or sent away and were able to work. Because we had restricted mobility between the 3 houses that were close by in the north of Melbourne that this had happened in, we were able to redeploy other workers. We certainly did need to pay people additional penalties, and we didn't quite have enough PPE on that Friday afternoon. So thanks to our colleagues at Life Without Barriers, we had some masks delivered later in the afternoon from them. We had delivered the communications that we'd pre-prepared to our residents and staff. And I think sometime over that weekend, we had a discussion within our management group and our emergency group around what we should and shouldn't be communicating to our staff and residents. And somewhere on the Sunday, I think we said, you know what, we just need to tell people the truth. If 3 people have COVID, if 1 resident has COVID, whatever it is, we just need to tell people the truth. And I think those transparent communications were some of the best decisions that we had made. We certainly had waste and cleaning in place. And interesting enough, one of our staff who had COVID in the end was a staff member that we had redeployed from the other house after we cleaned the house, after everyone with COVID had gone from the house. That worker tested positive. So we knew then that PPE was an issue for us. We're certainly unable to isolate the 1 resident that became positive, and she shared a house with 2 other people. So there was 3 middle-aged ladies sharing a house with 1 accessible bathroom. And that was a really big problem in relation to isolation. We needed to have more PPE in place. We didn't have enough. We thought we did, but we didn't have enough. And we certainly now realise the importance of donning and doffing that PPE. We've since put in place competency assessments, and our practice nurses literally virtually have met one-on-one with each of our workers all across Melbourne, and they've had competency assessments in the last couple of weeks. We've learnt that we need to have staff in reserve, and potentially if that situation on a Friday night had happened in one of our areas where we didn't have the restrictions around mobility in place, so if it had happened in the middle of the Geelong on that Friday night, there potentially would have been 4 houses that were taken out rather than 1 as far as workforce goes. So we've learned a lot about that in relation to having staff in reserve, and in those high complex houses we've actually got almost a bit of a SWAT team hanging on the side there, a couple of people that we've paid to do some work from home on the condition that they would be there, and they're quite highly skilled and they're some of the most experienced people, and they could go into any situation. We've really learned a lot about virtual supervision options and the importance of using apps such as WhatsApp, and the reality that supervision between a team leader and a worker can happen virtually, and that's probably something we didn't consider in the past. I think capital considerations in the future are going to be a great big learning from COVID, and certainly the lady that had gone to hospital, the Austin Hospital in Melbourne, she was very unhappy about having to leave her own home because she couldn't be isolated, and even though she tested positive for COVID, she didn't have any signs and symptoms, and she would have much preferred to stay at home. So I think the way people choose where they live is going to change in the future. Like I said before, the honest and constant safety conversations have been a great initiative for GenU, and I guess what we know now, and we didn't know then, we really didn't know that much about people's outside employment, even though we thought we had. Obviously, PPE and the isolation issues are continuing to present an issue for residents. In where we are now, so we've got some exhausted staff. People aren't taking sick leave. There's no weddings, parties or anything to go to. There's nowhere to go, so you might as well go to work. And we expect that will create leave and surge issues later in the year when the restrictions come off and no one wants to be at work because no one's actually had a holiday all year. So we've had to do a lot of leave planning now. We've recruited and screened a whole lot of new workers through our recruitment arm of GenU, and we've trained those people in COVID-related skills. So these are people who are willing and available to work to support people who have a disability, however, haven't necessarily come from a background of disability services. They have got a whole lot of customer service skills, but not necessarily in disability. So at the moment, they're working alongside experienced staff in Melbourne, but we're certainly expecting that we're going to have some kind of workforce demands later in the year.